Hello everyone, this is Mr. Kline and I'm going to review with you now the clinical and course orientation for 241, which is this summer of 2022. There are mandatory forms just like previous courses, just like 240, and again they're essentially the same forms that you completed in 240. You're going to resubmit them to 241. This is part of our regulatory process. We have to keep these items readily available in case our accreditors, Pennsylvania State Board of Nursing or ASIN, who accredits us as a 2-year program, we have to have ASIN accreditation because that allows you to attend a BSN program. So ASIN has its own separate list of criteria, and part of it is keeping various forms on file for you. That's part of the accreditation process. I know this is a redundant thing to do, but we have to do it. So there is a class recording release form that you need to Dropbox during the first week of class. That's in the main course Dropbox section on D2L. Also, there's an extensive ATI pharmacology med template assignment, which I will review here soon. This will be due on Thursday, June 2nd. That also gets Dropboxed. And then, just like your previous courses, that involves clinical, the UPMC Exhibit B form, that you already should have. Again, you're just placing that file into Dropbox for record keeping. And almost all of you should have by now also completed the COVID-19 training certificate for UPMC through the Wolf Academy. Please do that also and submit that to the 241 course Dropbox for proof of your COVID-19 training. And when you move on to 250, 251, you'll have to resubmit Exhibit B again, as well as the COVID training, as well as the recording of class. They're just ongoing forms we have to collect every semester. Now, one of the most important and significant projects for 241 is this ATI pharmacology assignment. It's a bit confusing, but it's all spelled out here. So, for 11 points, it's 11 possible points. You can get up to 11 points for this assignment. If you get fewer, you could still get an A for the course if you do well on all the course exams. So you don't need all 11 points to get an A for the course, but you do need to do this assignment as best you can to get close to 11 points as possible. So this pharmacology assignment's split into two parts. Part one is the ATI pharmacology assignment, and again, it's well spelled out in the D2L course shell, which we'll look at the end of this presentation. And this is due by Dropbox, the class lecture site Dropbox, by 11:30 on Thursday, June 2nd. So it's a series of worksheets essentially to complete, but I'll show you where that is at the end of this presentation. Part two is taking the proctored ATI-RN pharmacology exam, which you will do in the afternoon of June 30th. And again, all of our tests, all course tests, all ATI tests are on campus. Now, the 11 possible points for this assignment, again, includes Part 1, which is worth 7 points, and Part 2, which is worth up to 4 points. Again, it's based on your score, just like previous ATI proctored exams at the end of courses, where you can earn 4 points, 3 points, 2 points, or just 1. Again, ATI pharmacology assignment for 241 involves 11 possible points, maximum points. You're getting 7 points for Part 1, which is completion of written assignments that you Dropbox to the 241 Dropbox and the main lecture course area. And then Part 2 is you're getting up to 4 possible points or 4 maximum points for taking the proctored RN pharmacology exam on June 30th. And again, that will be on campus. And again, just to point out, failure to complete any of the assignments or turning them in on time will result in a 0 for that entire assignment of 11 points. This is just another breakdown of what the ATI pharmacology assignment is for 241. Again, part 1 involves a focus review and submitting that test result to the ATI Dropbox that's indicated in the 241 lecture course area. There's a Dropbox there for this assignment. So you're going to take a practice RN pharmacology test online. You're going to submit your results to the Dropbox that's labeled ATI pharmacology assignment. And then you're going to handwrite 5 written ATI medication templates and submit those also to the Dropbox for the ATI pharmacology assignment. That gives you 7 points. For this part 1, you're taking practice A and practice B. All right, you need to score 75% or better on these practice tests in order to obtain your 7 points, plus completing those 5 written medication templates. Again, they're all due to the Dropbox on the main lecture course Dropbox section of 241 by June 30th, which is the last day of class. On June 30th, following your main course final exam, you're going to have the proctored RN pharmacology exam. And again, highlighted in yellow are the 4 maximum points you could achieve based on what level you obtained taking that proctored exam. Students always question why so many tests and assignments related to pharmacology. It has been identified by previous HACC students that have graduated and taken the NCLEX exam that pharmacology is one section of several that HACC students have issues passing on the NCLEX exam. Oftentimes, and it's been proven with 2 recent cohorts that have taken the NCLEX exam in 2021, that they were very close, just a few questions, getting correct from passing their state board exam if they had done better on pharmacology questions. So this is why HACC is providing you more opportunity to practice and do well with pharmacology knowledge, because it's a significant issue with the state board examination, which is your NCLEX exam. Clinical schedule, you should know what that is, but now I've been emailing multiple revisions through the past few weeks. We're finalizing that now during the first week of May so we can get you credentialed for your clinical sites by the end of May, because we start class on May 26th. We begin clinicals the first weekend in June. So we must have a set clinical schedule the first week of May, giving UPMC and Penn State Health the time they need to generate your accounts, Epic Access, ID badges, and so forth. Your specific clinical sites, we're using just 2 main hospitals for 241 summer clinical for the STACK program. One hospital is Harrisburg, UPMC Harrisburg Hospital. The other one is Penn State Health Holy Spirit Medical Center in Camp Hill. At Harrisburg Hospital, we're using AG7, 6 main, and 10 main. To access these units, you enter the main hospital front entrance, go straight back the hall behind the main desk. When you enter the front entrance, go back that main hall to the end. There you'll see elevators. Take the elevator to the 7th floor, exit to the left, go across a glassed-in walkway that will take you to AG7. If you go to the 6th floor from that elevator, take you to main 6. If you go to the 10th floor, that will be main 10. Hospital addresses, main hospital numbers are there. For Penn State Health Holy Spirit Hospital, or Medical Center is its new name, since it was recently purchased by Penn State Health. That is in Camp Hill. That's on 21st Street. It's fairly easy to find. This is only going to be affecting a small group of students, about 6 students or so. We'll be going there for clinical. So the majority of the class only 6 of the 36 students actually are going to Penn State Health Holy Spirit Medical Center. So again, this information here only affects those 6 students. And of those 6 students that are going to Penn State Health Holy Spirit Medical Center, you will have specific EPIC training as well as other online training to do prior to the beginning of clinical at this hospital, and then you'll have additional clinical training to do on site. So your first clinical day at Holy Spirit Hospital, again, this is only affecting those 6 students that are going to Holy Spirit Hospital for clinical. Your first day of clinical will begin with about 3 hours of EPIC training. It's required by Penn State Health. We have to use their facility, computers to do it. And your clinical instructors with that rotation will help you through that orientation and training process. Specific information about parking: since we are there on the weekends, I will be distributing in class on the first day, which is May 26th, on campus in classroom 211 at the Select Medical Building, where our classes are held, a set of stickers. You'll get stickers to use. They have barcodes on them to allow you to park for free at the Brady Building parking garage. Please note these stickers with barcodes, when you use them, they are trackable. So if you're parking in the wrong place, I'll find out, and then you may be barred from parking there. So please park in the Brady parking garage, because we don't want to be kicked out of being able to park in the parking garage. Again, AG7, you can access it by taking the main hospital elevator for staff to the 7th floor, and then going to the left, going across the glassed-in walkway to get there. If you know of other ways to get into Alex Class 7, that is fine. But going to the main entrance to the 7th floor is one main way. Make sure you always have your mask with you when entering the building. You can take it off when you exit. Again, for those that may have to walk, if you prefer to park somewhere else on the street, in public parking, you can do that. It's not advised, but if you need escort, the security number is there. We do encourage all students to park in the Brady parking garage during clinical. However, for whatever reason you want to park on the street or public parking, which there are garages nearby the hospital, you're welcome to, but that's not advised. At Holy Spirit Hospital, it has limited parking. Weekends, it's not so difficult to find a space. What we do ask students as well as faculty is to park to the left of the main Heart Center building. So when you look at this photo, which I'm apologize that it's kind of fuzzy, the structure on the right is the original Holy Spirit Hospital that was built in 1964. It's in the shape of a cross because it's a Catholic hospital. The newer structure, which is much bigger with glass windows, that's the Heart Center. To the far left end of that structure, off the picture, but to the left, is another parking area. Please park there. It's a very short walk from that parking lot to the main entrance, which is the white-looking building in between the two large buildings. Again, do not park in the parking area that you see. That is reserved for visitors. We do have many elderly retirees that have difficulty ambulating that use that area to park. We do try to keep those parking spaces open for them. It's a courtesy because we are all visitors. Students think that they pay for clinical at these clinical sites, and that's far from the truth. Hospitals provide you their clinical site for your education, for your charge. Your tuition is paying for faculty, not the hospitals in which you have clinical. Again, regardless of the place you have clinical, wear your mask while on premises. Clinical expectations. Please be sure to notify faculty at least 30 minutes before clinical begins if you're going to be ill or for some other reason you're not able to make clinical. If you're not able to reschedule within 48 hours, that will result in an academic deficiency. Please make sure you do know that if you're tied up in traffic or delayed for whatever reason and you're late to clinical, you will get an AD. Please be sure to have your proper identification, your HACC PIN, your HACC photo ID, your bandage scissors, stethoscope. We don't need face shield anymore, but you definitely need your mask, medical grade mask, to wear at the clinical sites at this time. Shields are no longer needed. I'll update this slide. But again, if you're coming to clinical without proper identification, ID tag, photo ID, bandage scissors is what should be on here, stethoscope, and your mask, you can get also an AD. It's requirement. It's actually Pennsylvania Nursing State Board law, Department of Health law, that any person having contact with an inpatient in a hospital setting must be wearing some form of photo identification. So that's why you always see even volunteers in a hospital wearing some form of identification. It is required by the Department of Health. So that's why we're so strict with it at HACC. Again, I still keep the COVID information on here because we could go back to it at any time. But for now, unless you hear differently from faculty, you do not need your shields for clinical. You do not need your shields for our lab day, but you still need your medical grade mask to wear during clinical. Cafeterias are open on the weekends at all of our healthcare facilities, so you're welcome to bring your own lunch or purchase lunch there at the hospital cafeteria during clinical. Our one and only skill to be validated with is NT suction. So do go through your previous lab supply bags that you have and pull out the NT suction kit and bring that with you for testing during Memorial Day weekend in late May. So we're going to have class on Thursday, May 26th. The college is always closed on Fridays in the summer, so nothing's open at HACC on Fridays. So we'll meet for class on the 26th. Then we'll come back on Saturday and Sunday for NT suction skill. Just like 240, you will have a half-hour time period to come in either day. We're beginning, I think, at 9 a.m. We're going no later than about 1 p.m. to get the entire group of 36 students through. If your clinical group is scheduled Saturday, you'll have a time on Saturday. If you're scheduled for Sunday clinical, you'll be in on Sunday. Again, you only come for the time that you need to be tested. It's an opportunity to meet your clinical faculty at that time also. Again, just like 240, it's set up the same, and it's all, again, on D2L in the clinical course shell is where all the NT suction information is located. The rubric, the practice rubric, and then the testing preparation, which gives you the schedule. It'll list your name and the time slot for you to come, and then the faculty will be listed there too. We're hoping to set up at least 3 to 4 stations so we can get through students through, for the most part, during the morning hours of both days. The only written preparation for this particular sign-off skill is the ATI Skills Module 3.0 for air management. This you have to complete prior to the skills day, and that proof of completion of that module also needs to be placed to a Dropbox that's also located in the clinical D2L shell. I will be emailing the NT suction testing schedule with information to you by your HACC mail, and it also will be included on the D2L course shell, so you know, again, where to find it. And with our first day of class, I will briefly go through significant aspects of orientation, which is going to be the skill day information, the ATI pharmacology assignment, and then looking specifically at our lecture and exam schedule. And then taking questions up to about 9:30, and then we're going to have class for the duration of the morning. That's the plan for the first day of class at school in room 211 on May 26th, which is a Thursday. Remember, just like 240, a lot of things we did in 240 are going to carry over to 241. So we continue with computer documentation on site. So in EPIC, you'll be charting your vital signs, your patient assessment, your IV assessment or central line assessment, and any patient care you do, including INO. And this will be for both UPMC units as well as Penn State Health Holy Spirit Medical Center units that you're on. As far as clinical paperwork, I'll also mention this again during our first day of class. There is one patho paper due and 2 nursing diagnosis worksheets due for the entire rotation, because as you're going to see, we only have 4 days of clinical during 241. So essentially the first day is orientation, then it's up to your clinical instructor how they want you to do this. Basically, one weekend day you should be doing the patho paper. The remaining 2 clinical days or weekend days you should do the primary nursing diagnosis worksheet. Again, 1 primary nursing diagnosis worksheet on 1 patient. So 1 worksheet for 1 patient, 1 patho paper on 1 patient, 3 total written assignments for the entire 241 clinical rotation. Same information as was with 240. We want you to write your patho paper on a medical surgical diagnosis. That should be easy to find with the multitude of different types of diagnoses you're going to see on AG7, which tends to be a little bit more ortho, and the other units that are more med surg. So you can do things of CHF, you can do things of diabetes type 1, end-stage renal. Things like failure to thrive would be very difficult to write about because it's a very definitive diagnosis that there's not a significant amount of patho for. So failure to thrive would not be a good one to do. But end-stage renal would be good to do. Rhabdomyolysis would be fantastic to do because of all the nursing care and medical interventions with that. You can also do cancer patients if they're available. Neuro patients that have unique neuro conditions would be fine as well. Again, just like 240, the patho papers due in a week to your clinical instructor. And each clinical instructor has their own Dropbox. You'll be able to place these items in specific areas within those Dropboxes. And then there'll be a clinical day rubric where the rubric will cover your particular clinical day. So your faculty can also evaluate your clinical performance for that day. On D2L, in the clinical shell for 241, there are blank templates for your nursing diagnosis worksheets, blank templates for the patho paper, and examples of both. Again, just like 240, check with your instructor as far as the appropriate patient to choose for your patho paper. You want to make sure you do choose a patient that was symptomatic, for the disorder that you're choosing, and then follow the guidelines for the patho paper as listed on the rubric within the D2L clinical course shell. These slides, this give you more information. Again, this is exactly what you did in 240. Again, you're writing your paper narratively. You're describing in detail the pathophysiology. Your assessment is going to include not just your physical assessment, but also labs and medical testing that was done to support your pathophysiology as identified. It's not written in first person. You're not using I. You want to include factual information. You do not want to be making assumptions. You're going to state facts. It's going to be very subjective And there's great examples here on the screen. And you do not use your patient's real name. We want you to use initials. That way, if this document gets out of your hands, it gets emailed or spread around the internet or misplaced, then the reader has no idea who the patient was. Again, just like 240, we're following the same pathway paper process. So section 1 is going to be the end of the intro. Section 2 is going to be the header to assessment with specific information listed for each section, listed here on the screen. The third section is going to be a summarized pathophysiology. Again, this is a pathway paper, so this should be the most significant part, or the biggest part of your paper. You're giving a little bit of background information, statistics with particular disease, or even surgery, if you find something appropriate to write about as far as a surgical intervention. And again, this slide's giving you great detail as far as how to write the specifics for the pathway section of the pathway paper. You want to mention medical treatments. You always want to correlate the pathway to the current symptoms that the patient has, including their lab tests, any medical tests, any medication that they're taking. And everything should be specific to your patient. And then at the very end there, you want to be able to cite and reference your information. Section 4 is the labs, so you're identifying abnormal labs and explaining them. And again, you're discussing the labs, just not listing them as abnormal or normal. You want to give some explanation to the reason for the abnormality and how it relates to the pathophysiology of your specific patient. Section 5 is medications. This should list the schedule and PRN, classification of each, and the reason for administration. Because sometimes medications that are ordered that we think are used for one reason may not be the reason why your patient's taking it. If possible, you should attach the diagnostic lab sheet if you're able to print it out from Epic. This can be an issue with Epic, so you may not be able to. Just let your instructor know. Section 6 is a diagnosis map. This is where you want to include 2 priority nursing diagnoses for your patient. Again, more details listed here on the screen. And then the last section is your references, which we want in APA or MLA format. And we always want you to use reputable sources. No Wikipedia. Medscape is fine, but you want to use American Journal of Nursing. You want to go online to your HACC library, access, utilize CINAHL, because CINAHL is going to give you nursing journal specific information. And this is important. It's great practice for your BSN courses that you're going to be taking next year or two, because if you have any desire to work in a hospital, you're going to have a BSN degree. So you're going to have to get used to doing more paper writing that involves research and APA formatting. So you need to start using the databases from which you need to extract the referenced material, the empirical researched or peer-reviewed information that you can properly reference. So start doing that now. It'll save you a lot of work as far as learning later on. Switching now to the narrative pathophysiology as far as what this paper should look like. This screen gives you a great example. There's also a written example on D2L that you can print out from the 241 course shell. I advise you to look at it for further help in writing the final paper form. Now, your nursing diagnosis worksheet, you should be well aware of what it is. You've been doing it throughout 240. Again, for the 2 clinical days that you're going to be writing your primary nursing diagnosis worksheet, you want to check with your instructor to find out which patient would be appropriate. Again, your patient should be symptomatic with the disorder that you're writing about, and again following the guidelines. They're the same guidelines as we are using from 240. We're applied to 241, so nothing's changed with the nursing diagnosis worksheet. It's essentially the same as 240. So again, you're going to do 2 of these during 241. You can type them or neatly handwrite them. You can complete it by the end of the clinical day, but you always want to submit it by Dropbox. That's a requirement. All right. So for students we know who may get a situation where they're taking care of 2 patients or 3 patients and they have a very busy day, they can't finish it on time, we do give you a few hour extension, but for the most part, your priority nursing diagnosis worksheet should be completed during the clinical day on site, because you're going to remember you're on clinical from 7 a.m. to 5 p.m. All right. We are going to do discussion boards. That'll take up an hour. So we're going to finish at 4. But you're still at the clinical site from 7 to 4 p.m. All right, that's a 9-hour day. You should be able to complete this 2-page worksheet that you're used to using in 8 hours on 1 patient. So there's no reason to be able to get it done in time. Again, more information here on the screen about the primary nursing diagnosis worksheet. This slide just shows you more of how to fill it out. Again, you can play this podcast back and look at the detail. Again, I have a sample also on D2I that you can download and look at if you wish to get more help on how to fill these out. This is showing you the medical interventions and making sure that you take the time to explain those medical interventions. And then your nursing interventions. Again, you want to keep your nursing intervention something that an RN can do. Is it measurable? Is it repeatable? But again, it has to be within the scope of practice of an RN. It can't be a medical intervention. And then your NANDA statements, your nursing diagnosis, are listed here. And this is what a completed nursing diagnosis worksheet looks like. We do like you to highlight sections of the worksheet that have significant data information or information that's indicating a change in the patient. That should be highlighted in yellow. But again, you should be well used to using this worksheet since you had it in a 240. But again, you're going to be doing 2 of these during the entire rotation, just 1 on 1 patient, just 2 total for the entire rotation. And again, you want to complete this worksheet during the clinical day and submit it to Dropbox. Again, you're going to have 9 hours of clinical time to get 1 worksheet done. It's not impossible. The clinical tool is digital. Each week, your clinical instructor will be able to fill out a rubric. It has the same goals and expectations as the written paper tool has. It's this in digital form, and there's 1 tool or set of rubric information for each week. So you'll just have to look in the Dropbox for that weekend. What I've done is designed the Dropboxes so where one Dropbox covers 1 whole weekend. That way you can, during your weekend, complete your documentation and keep it more organized. If I'm able to keep everything organized as far as dates of a calendar. So when you submit your pathophysiology paper for week 2, your instructor will have a rubric to attach to it that will be your clinical evaluation for that day. And then the same for week 2 and 3 and 4. Now, when we get into 250, you're going to be doing consecutive weekend days. You're going to do Saturday and Sunday. There, you'll do a worksheet for both days. You basically update the worksheet during 250. And in 250, you'll also have a digital tool rubric that the instructor will also fill out for each weekend. As far as IV skills are concerned, remember we're only there in 241 as far as clinical days for 4 days total. So a few groups, like my group at Holy Spirit Hospital, they're losing their first clinical day mostly to computer training. So they're not going to have an advantage of having 4 whole clinical days. So for this reason, I'm going to require just 1 IV push med and 1 IV piggyback medication for the entire rotation. If for some reason you don't get both because of patient discharges, something else has happened, faculty will help you through just a skill validation on the unit, which is not uncommon. Also during clinical, faculty will help you review the IV pumps. They are the same as far as Alaris pumps. You'll find them the same at Penn State Health as well as UPMC. So it should be a great time to review as you're working through 241. And remember, as far as final clinical evaluation, to pass clinical, you want to make sure that you're giving 1 IV push drug, 1 IV piggyback drug, which your faculty should be keeping note of. I keep a chart week to week, so I know what students need as far as skills. And then you want to meet your evaluation of all clinical assignments. You want to meet your skill day assignment of NT suction. So you want to submit that skill module completion sheet to the Dropbox, and then actually do the testing off of NT suction on Memorial Day weekend. And then you want to make sure you have them met for your individual clinical days at the hospital that you've been assigned to. Regarding course orientation to 241, I'm going to show you the correct course. This is what you're used to as far as 240. If you go out to your main D2L course selection screen, which is you click on the tiny little house, multiple courses should open. So we're going to go into summer 2022, and we're going to look for this picture of an orchard, peach orchard at dawn, and it's nursing 241002. That's the lecture course shell, and then beneath it is a Canon in silhouette that is 241004. That's the clinical shell. Now, clicking on the course shell, the lecture course shell, there's a welcome statement there from me. Here, again, repeats everything I've already told you about. So we're going to begin our first day of class, Thursday, May the 26th, in room 211 in the Psych Medical Building, which is our nursing building on campus. We're going to meet from 9 to 12:40. We will take breaks during that time. And this will be our first day of class. Then from there, we'll follow the lecture schedule to tell you as far as what's happening, as far as whether we're having class by Zoom or we're coming to class for an exam and then staying for class, or what's going on. So I'll show you that here soon. Main things to keep in mind with nursing 241, the most significant thing to know is there is this ATI pharmacology assignment, which I've talked about in this podcast. More information here. It involves taking a practice test A and a practice test B, and then completing templates, 5 medical templates or medication templates. The 5 medication templates in the 2 practice tests, A and B, are all due by June 30th. All right, by June 2nd, excuse me. It's here. Part 1 of this pharmacology ATI assignment, which is the 5 medication templates and the 2 practice tests are due by Thursday, June 2nd. You can work ahead if you want, but your first assignment is going to be due June 2nd. Again, it is your ATI Pharmacology Assignment Part 1, which is the 5 written medication templates and these 2 practice pharmacology exams. Then Part 2 is going to be June 30th. That is at the end of the day when we take the course exam. So on June 30th, you're going to have the final exam for 241. You're going to have a nice break. Then you're going to take the ATI Pharmacology exam after your course exam. That happens on June 30th. That proctored ATI Pharmacology exam is Part 2 of this pharmacology assignment. Again, there's 11 possible points total for Parts 1 and 2. If you don't do them by the deadlines, you don't get points. All right, so be sure to get Part 1 done by June 2nd, otherwise you get a 0. The rest of this is this general information which you should be aware of by taking the nursing courses. Again, make sure you have access to Pearson, Unbound Medicine, Nursing Central, which I think most students by now do. Again, you want to be uploading, as I pointed out in the podcast already, what forms you need to post to the drop boxes. Your Exhibit A for UPMC, your COVID training for UPMC, the form for class recording information. Because we're doing 2 days of Zoom, we're going to have your permission to record that. And then, of course, this ATI pharmacology assignment. Clinical information is here as well. The main thing to point out is our skills day lab on Memorial Day weekend. You're going to be there 1 day for half an hour and then leave. Again, I'm going to email you that schedule as well as post it on D2L. Very self-explanatory. There is 1 written assignment with the skills day, and that is skills module 3.0, airway management, and that due date is included in the course module with the other information for the NT suction skills. Again, we start day 1, first day of class on Thursday, May 26th on campus in the Select Medical Building, our nursing building in room 211. We'll be there from 9 a.m. to almost 1 p.m. The other section I want to point out is content. So I want to go through where things are located. So click on syllabus and nursing student handbook. The handbook hasn't changed. That'll change in the fall. When you click on syllabus here, I want to point out to you the main sections that are at the end, because all the beginning information is basically the same from syllabus to syllabus. But what I do want to point out is the lecture and exam schedule. So this first chart here is showing you that you have 3 exams, how many points they're worth. Your pharmacology assignment's worth 11 points total, 7 points for part 1, and then 4 points for part 2, and then how many points you can get for taking the proctored pharmacology exam. And then the overall grade point average chart is at the bottom. A very important note here is the color-coded chart of when we have class and when we have exams. So orange is our first day on campus, May 26th. Going to do very brief course orientation because I've already pre-recorded it by this podcast. So for the most part, I'm going to point out a couple things that are important and then take your questions for about a half an hour, and that's it. Then we're going to go over liver disease, hepatitis, and pancreatitis. Class week 2, June 2nd, we're going to be on Zoom. And then just noting there that June 2nd, part 1 of your ATI assignment is due. If it is not handed in by 11:30 p.m. on June 2nd, you get 0 points. Then our first exam is going to be June 9th. And after exam 1, which is in Blocker Building, we're going to walk back to our classroom building in Select Medical and do acid-base balance review. So that'll be a lecture after exam 1. Then the 4th week, we're by Zoom. We're going to talk about Parkinson's and thyroid. Then the last 2 weeks of class will be exam 2, talking about sepsis after exam 2 in class. And then the final day of class, week 6, on June 30th, is going to be your final exam and your ATI proctored exam. Both exams on the same day at the Blocker building. And this is going to take up the entire morning until a little bit in the afternoon. Additional information there about the lab skills day that I've been talking about, and just to point out that our lecture class is going to be held in Select Medical Classroom 211. Your exams will be face-to-face using school computers in Blocker Building 117. But we're going back to class after exams to do lecture on the same day. That's why that's all color-coded blue. Yellow is when we're remote at home, and then orange is the first day. Finally, what I want to point out are the drop boxes. Here you'll see drop boxes. Ignore Exhibit A. You don't need to submit that. But from your access, you'll see that you'll have to submit Form B, COVID-19, class recording release, and then at the very bottom on the main course shell is the ATI pharmacology assignment. Going back out to the whole set of clinical shells, going into the clinical course shell. Here, additional information I've been talking about. When is our skills lab day? When is the written assignment due for the skills day? That is the Airway Management Module 3.0. That's due June 5th. All right. There's a Dropbox here in the clinical shell for that. And then there's quick links here to take you to the syllabus, skills day, clinical information, clinical tool. All that stuff I already talked about and you should be familiar with. Within content for the clinical shell, the main thing there is going to be your 241 skills. This is where all the information you need to know for the clinical skill day is located. And then the 241 skills day instruction student. This I'll email to you. It's already on D2L here for you. This lists which group you're in and what time for you to come. Again, you're going to see Saturday we're going from 9 to no later than 12, and then Sunday is an hour, half hour earlier we finish. We go from 9 to 11:30 because there's fewer students on Sundays. And just to point out that under Dropbox, each instructor has his or her own set of Dropboxes. So when you go in to Dropbox, all your different things, you will see a Dropbox set up for patho paper, the priority nursing diagnosis worksheets 1 and 2, your ATI skill module, airway management assignment for the skills day, and then you'll see each clinical weekend is indicated. Those are the rubrics. There's where you'll go in and, for example, we can have you Dropbox your clinical paperwork for that weekend, and then we can attach the priority nursing diagnosis worksheet there. We can attach the rubric to give you an eval for the clinical weekend for that section. So there's a set of Dropboxes for each instructor. That's how it's laid out. Again, going to hit these major sections during our first day of class, take questions up to a half an hour, and then get into class course content review. So this ends this podcast on 241 STACK Summer 222 2022 review of clinical and course expectations and all the various written assignments and exams. Have a good day.